the smoke haze. It's been lingering over Sydney for more than a month now. The Weather Bureau is predicting that skies will clear by Sunday, but as Amber mentioned earlier, there's no rain on the horizon, and doctors are seeing an increase in patients, not just with respiratory issues, but with eye complaints as well. Dr. Neil Sharma is an ophthalmologist with eye and retina specialist in Sydney. He's on the line now. Hi, Neil.
Hi, Deb. How are you today?
What are the problems that people are seeing with their eyes?
Well, with the bushfire smoke across much of the country, there's been a large number of patients with red, irritated, burning and stinging eyes, and certainly those people with underlying dry eye conditions or blepharitis are noticing a worsening of their symptoms, but also patients who had previously sort of normal or healthy eyes are also suffering a lot of those sort of symptoms from the smoke particles.
Can it lead to any permanent damage to the eyes if you're exposed for long periods to this sort of bushfire haze? Because as we mentioned, it's been in and around Sydney for a month or so now, and you can see the ash falling from the sky.
Yeah, certainly. I mean, in the worst cases, it could cause sort of more significant problems with the eyes, but for most people, it's more of a sort of irritation, pain, or an awful sensation, and almost every patient or second patient that's come to my clinic in the last couple of days has complained how their eyes are stinging and sore. So it certainly is very common just amongst the general community. We
know that people with breathing problems can use these face masks, but what can people with eye issues do?
The general advice in terms of trying to remain indoors as much as possible and not being exposed certainly goes for the eyes as well. But in addition, patients who might use artificial teardrops or over-the-counter lubricants should think about increasing the dosage that they're using, or if people haven't used artificial teardrops, just at the chemist or pharmacist, they should be able to get some artificial teardrops. Some cold compresses will bring some relief in that from a symptom point of view, or if the symptoms are getting worse, then to see their GP, the optometrist, or their eye specialist. And
are the eye drops okay for people of all ages to use? Is it okay for young kids to be using those eye drops as well?
Yeah, so if they're artificial teardrops, such as, there's a few different brands available, just talk to the chemist, but Sustain or Refresh or Genteel, there's a number of brands, and essentially they mimic your natural tears, and so provided they're not medicated and over-the-counter, then they are suitable for all ages. And if you're using it frequently, a preservative-free formulation is what I would recommend. A little tip is to store them in the fridge so that if the eyes are burning and stinging, then it gives a little bit of cooling relief once the drops are instilled as well.
Yeah, and it is a real concern, isn't it, when we are exposed for such long periods of time. So if people are worried, if they're concerned, when should they make an appointment to try to see a GP or a specialist? When's the sort of tipping point?
I think certainly if the symptoms are sort of manageable and just uncomfortable, then most people can manage themselves at home with simple treatments. But if it's getting sort of more severe or the vision's being affected, the eyes are particularly red, or there's a sort of other red flag that they're worried about, I'd certainly be seeking medical advice or their optometrist with the other option as well.
Great advice as always. Thank you for that, Dr. Neil Sharma there, who is the ophthalmologist at Eye and Retina Specialist in Sydney. And I know that bushfire haze is impacting a lot of people, so do stay safe. Well, that's the show.